As the Hmong team counselor, Chai Tao is here. They're a little shy about telling their stories, but can you share with us, a little bit about the Hmong community and some of the mental health issues that the young people are facing and why it's so difficult?
Yeah, mental health has a great stigma within the Hmong community, and it already has a stigma in the community itself. But with that even more engraved with the Hmong community, it's just really, really hard to be accepted and to be acknowledged. So the problem is avoided, and that's why it's such a big problem. So,
and you got involved in mental health as a profession when that was the cultural perception of mental health. So why did you get into this as a profession?
I got into this as a profession with my life experiences growing up, and I see a lot of the same experiences that many of the youth I work with have, and it's just life learning experiences that draw me into this profession.
Is it depression that a lot of these young people face, or are there other kinds of things that they're facing?
It's more like behavioral issues, the community, society itself, growing up in poverty, being a minority, having problems, with cultural issues.
That's one thing that's really important part of our program and the teams, the cultural teams, is as Chai was explaining, a lot of those issues growing up in the Hmong community, somebody from outside of the Hmong community would not necessarily understand those issues, and so wouldn't really be able to help the youth in the same way that somebody that grew up in that environment would. And that is one of the unique, really cool things about the program.
Our phone number is 1-800-234-5246. We have several counselors from the Connecting Circles of Care program. Also, Lori Dana, who is with their social marketing efforts, and then for young people as well. Some of these specifically rural issues, I think, are kind of fascinating. Do we have different mental health issues in rural Northern California than, say, in some urban areas? Are we different, or just the same?
Well, I think one of the things is very much the same, is that there's a distrust from people in rural areas, and that, and there's also kind of a norm that you have to fit to be accepted within that community. Typically as a counselor, if I were to show up, looking pristine with a suit and tie and show up in a vehicle that's out of place, I'm automatically going to be maybe ostracized, not the right word, but I'm going to be kept or held at bay, because people aren't really going to know how to take me, looking like that, and it's a lot different than what they're experiencing in their day-to-day lives, and to be honest, a lot of what happens in their day-to-day lives, if it may involve, like CPS, which has a lot of its benefits, but CPS is a lot of what people tend to associate us with. They see people coming to help as a government agency, typically coming in to take tear the family down, or take people away, or to lock them up, or to cite them. So more often than not, they kind of look within their own communities for people that are going to help, and that's what we try to do in Connecting Circles of Care. Is we try to be exactly those people that can fill the gaps for them in their day-to-day lives.
Montrell Jamari is here, a counselor with African American team. Do you think there are some specifically rural issues that affect our teens?
It depends on what you mean by rural, but there are some significant issues that happen even within the African American community. Like Chai, he grew up in his community. I grew up in Southside Oroville, and so I know some of the different type of dilemmas that go on in Southside, as far as drugs, alcohol, prostitution, things of that nature, and the spiraling effect that happens to different individuals there. So I think along with what John is saying too is that when one has grown up in that community and they've gone to work for Butte County Behavioral Health and then they go back to the same community, that level of distrust is almost non-existent there because they see your face, they're familiar with you, so they're most likely to let you into the home. So I think there are different kinds of stigmas involved, and there's different kinds of diagnosis. A lot of kids go undiagnosed. They may be faced with depression or being bipolar, but there's a fear for, just like what John was saying about different government agencies coming in to take away. But once they see a face that they are familiar with, then they're most likely to be diagnosed and to seek help.
Our phone number is 1-800-234-5246. I think at this point we'll introduce you to one more young person that we have in the room, which is Dave. And I think of Dave after hearing John Amos talk about how people wouldn't trust him if he looked a certain way or showed up a certain car, because I think John was one of the first counselors that you saw. So maybe you could tell us, you have a very interesting story that I know you've been willing to share with people, and I think it's a really significant story about how someone could be depressed as a young person and turn it all around. And I think it's a really impressive story.
Hello. From my experiences, I've been in counseling for like 6 years, and like none of the other programs were helping me at all. But then, like, when CCOC came up, like, I was near rock bottom, just like with depression. I had suicidal thoughts, stuff of that nature. And, like, a couple people from CCOC show up in my living room. I wake up, and they're in the living room talking to my mom and my grandma. And, like, John Amos, he's just a super cool guy. And he was, like, in there, acting like a normal... I'd see him as an overgrown teenager just from how he was dressed, and just felt really comforting to, be around him. And like the first time I went out with him and another counselor, I just hit it off with both of them, and it was just really cool the way that they affected my life. I went from like rock bottom up. It's been 2 years since I've been in the program, and it's like really helped me so much. What I've been doing lately is CCOC has certain committees of sorts which help keep the program running, and the youth are able to attend the meetings and put their input in and have it actually work. And I sit on a few of those committees, and I try to put my input in as much as possible so I can make sure this program keeps running and helps kids of my age or even younger or older who have been going through the same thing, and they can get the help they need fast and effective.
Now, you've gotten into some trouble.
Yeah.
You weren't able to go back to school.
Yeah. But it was more of I didn't really want to. It's because before I had counselors, they'd come to school a lot. They'd see like me get into a fight with a bunch of kids. Didn't really do nothing about it. The principal was, a jerk. And, after a while, I got in a fight one last time in 6th grade. And like, I was just fed up with it. I just basically just quit school. And for like 2 years, it took for me to get back on track.
You stayed home?
I attempted homeschooling. I attempted homeschooling, which was more of it was like the closest way to quitting school, which wouldn't cause that much problem. But I didn't do the work whatsoever. I had problem with truancy issues, stuff of that nature, which was really hard to deal with at one point. Just because what. I didn't want to go to school. I couldn't stand being around the kids, or the teachers weren't getting me. They were just being, just mean and downright bad. Like I've had very terrible experiences at school, and from basically everything to almost getting stabbed, having a gun pulled on me, and this is all even before middle school, which I think should not be happening whatsoever. And because none of the kids are getting the right help. And just from that point on, I've kind of, I made a choice in my life to, get it better so I can help other kids who go through the same thing. And this program is been so successful for me. It's helped me go from almost attempting suicide to helping others not attempt that or even get to in that nature. And I'm pretty street smart with all the other stuff. I know about drugs and all the different stuff because